makeup of the hip is pretty simple. There are 3 bones that make up the hip. The first one is the ischium. This is located posteriorly and is superficial to the ischium and pubis. The next bone is the ischium. This is located posteriorly. The last bone that makes up the hip is the pubis. This bone is located anteriorly. Then there are 3 other bones that make up the bony anatomy of the pelvis and thigh. The first is the femur. This bone is a long bone. Then next is your coccyx. This bone is 4 fused bones put together. You may also know this bone as your tailbone. The last bone that makes up the bony anatomy of the pelvis and thigh is the sacrum. The sacrum is made up of 5 fused bones put together. The sacrum is also part of your spine. Now as I move on to the limits of the pelvis and thigh, it becomes a little more complicated. Starting from a posterior view of the pelvis, you will see that you have the iliofemoral and the ischiofemoral ligaments. And now as we stay at a posterior view, but on the lateral view, you come across a few more ligaments. These ligaments are the sacrotuberosity, the iliolumbar, the posterior sacroiliac, the supraspinous, posterior sacrococcygeal, sacrospinous, and the arterial membrane. Now we will move to an anterior view, but on the lateral side. From this view, there are a few more ligaments, starting with the inguinal, which is a ligament and a tendon. Then you have the sacrospinous, the sacrotuberous, the anterior sacroiliac, the ilium lumbar, and the anterior longitudinal. Lastly, there are just a few other ligaments to talk about. These ligaments are the intercoccygeal ligament, the round ligament, also known as the ligamentous capsule femoral ligament, and lastly we have the pubofemoral. Now moving on to the muscular anatomy of the pelvis and thigh, starting with the muscles that help with flexion at the coxal joint, also known as the hip joint. The muscles are the psoas major and the psoas minor. Iliacus, the tensor fasciitis, the sartorius, the rectus femoris, the gluteus medius anterior fibers. There's the pectineus assists, the gluteus medius, and then your adductor longus assists, adductor brevis also assists, and your adductor magnus assists as well. Now here are the muscles that help with extension at the coxal joint, starting with the gluteus maximus, all fibers, the bicep femoris, long head, the semitendinosus and the semimembranosus, the abductor mangus, posterior fibers, and the gluteus medius posterior fibers. Lastly, there are just a few other muscles that are involved. They are the gracilis, the plantaris, the bicep femoris short head. You have the levator ani, which is made up of 3 muscles, and these muscles are pubis rectalis, the pubis coccygeal, and the iliococcygeal. And then we have the coccygeal and the pisiformis, gemellus superior and anterior, the quadriceps femoris. Lastly, we have the superficial / deep transverse perineal. Now I'm going to move on to the tendons of the pelvis and thigh. There are only a few tendons in the pelvis and thigh. These tendons are the rectus femoris tendon, vascular-medius and vascular-lateral tendons, the bicep femoris tendon, the iliotibial tract, also known as your IT band, and lastly, your hamstring tendons. Last thing I'm going to talk about with the pelvis and thigh are the joints of the pelvis and thigh. There are only 3 joints, and they are the coxal joint, also known as the hip joint, the sacroiliac joint, and the sacrococcygeal joint.
The bony anatomy of the knee is quite simple. It involves 4 major bones, the first being the femur, which is in the upper portion of the leg. You then have the tibia and the fibula, which are in the lower portion of the leg. The femur, tibia, and fibula are all long bones. The 4th and final bone of the knee is the patella. The patella is a sesamoid bone. The head of the femur is a ball-shaped bony prominence known as the acetabulum. The acetabulum is found proximal to the knee. At the most distal portion of the femur are the lateral and medial epicondyles. Next, the ligamentous anatomy of the knee. There are many important ligaments of the knee. The first is the MCL, or medial collateral ligament. The MCL is on the inside portion of the knee. The LCL is the lateral collateral ligament, which is found on the outside portion of the knee. The ACL, or the anterior cruciate ligament, is named because of where it attaches, on the anterior of the tibia. The function of the ACL is to prevent the tibia from sliding in front of the femur. The PCL, or posterior cruciate ligament, attaches to the posterior portion of the tibia. The function of the PCL is to prevent the tibia from sliding in behind the femur. The knee also contains the patellar ligament. The knee also contains two structures called the meniscuses. They are the lateral and medial meniscus, because they lie underneath the condyles of the femur. The final ligament of the knee is a transverse ligament. The transverse ligament connects the lateral and medial meniscus. Next, we have the muscular anatomy of the knee. There are many muscles that help the knee to extend and flex. The first group of muscles are the hamstrings. The hamstrings include the semimembranosus, semitendinosus, and the biceps femoris short and long head. The second group of muscles are the quadricep muscles. These include the vastus lateralis, the vastus intermedius, vastus medialis, and the rectus femoris. The hamstrings extend the knee and the quadriceps flex the knee. The lower leg also has many muscles that not only help the knee function, but help keep stability, but they also help the ankle function as well. The muscles of the lower leg are the fibularis longus, tibialis anterior, the sartorius, the soleus, the plantaris, the gracilis, and the popliteal muscle, the gastrocnemius, and the tibialis posterior. All of these muscles help the ankle plantar flex, dorsiflex, evert, and invert. Finally, we have the tendons of the knee. Tendons attach muscles to bone. The tendons include the quadriceps tendon, the popliteus tendon, the plantaris tendon, and the biceps femoris tendon. And finally, the pes anserines tendon. The pes anserine tendon is made up of tendons from the muscles of the sartorius, gracilis, and the semitendinosus. The knee is a hinge joint because it only moves in one plane. As said before, the knee can flex and extend. The knee also contains the tibiofemoral joint and the proximal tibiofibular joint. Both of these joints are synovial joints. The final joint is the patellofemoral joint, which is a diarthrodial joint.
The bony anatomy of the ankle is pretty simple. You have the calcaneus, which is your heel bone, the talus, which sits in next to the calcaneus. Then comes the navicular, which is more medial. The cuboid is more lateral. Next we have the cuneiforms, which are made up of three bones, medial, middle, and lateral. Finally, there are the tarsals, metatarsals, and phalanges. Up next is the ligamentous anatomy of the ankle. There are three major groups of ligaments that make up the ankle. The deltoid ligament consists of four ligaments: the tibiocalcaneal, tibionavicular, posterior superficial tibiotalar, and lastly the anterior tibiotalar ligament. The second group of ligaments are the lateral collateral ligaments, which are made up of three other ligaments: the anterior talofibular ligament, posterior talofibular, and calcaneal fibular ligament. The third and final ligament group is the spring ligament. This is made up by one other ligament, which is the plantar calcaneal navicular ligament. Now on to the muscular anatomy of the ankle and lower leg. Closest to the toes, we have the adductor hallucis and the flexor hallucis brevis. Then moving down the foot to the heel, we have the abductor digit minimi, flexor digit minimi brevis, and the quadratus plantae. Now moving up towards the knee, we have the gastrocnemius and soleus, the peroneal longus and brevis, and lastly the tibialis anterior and posterior muscles. Next is the tendon anatomy of the ankle. To start us off, we have the tibialis anterior tendon. Next to that is the flexor digitorum longus and calcaneal tendon. Going into the foot, the tendons are extensor digitorum longus, extensor hallucis longus, and next to that is the fibularis tertius tendon. Another tendon is the posterior tibialis tendon, and the tendon of flexor of ankle and toes. The final two tendons in the ankle are the peroneus longus and peroneus brevis. The last thing to talk about in the ankle are the 7 joints, starting with the tibiofibular joint, the talonavicular, then the tarsal-metatarsal joint. Moving down to the toes, we have the metatarsophalangeal joint and the interphalangeal joint. Lastly, we have the subtalar and calcaneal cuboid joint.
The loading phase is the first phase of a fallow shot. Starting at the feet, the ankle is in dorsiflexion, while the gastrocnemius and soleus are extended. The knees are flexed. The hamstrings are going to be flexing the knee and extending the hip. The quadriceps are flexing the hip while the knee is flexed. The pelvis is anteriorly rotated. The dominant elbow that is gripping the ball is flexed. The shoulder girdle is upwardly rotated. And the wrist is slightly elevated and rotated medially. The non-dominant elbow is flexed. The shoulder girdle is slightly rotated, but not as much as the dominant shoulder, and the wrist is in a neutral position, stabilizing the ball.
In phase 2, starting at the foot, the ankle is starting to go into plantar flexion. Then the gastrocnemius and the soleus are also starting to go into extension. The knee is starting to go into extension. The hamstring muscles would be going into extension along with the knee. The pelvis will be starting to go into extension as well. The quadricep muscles would be in flexion. Your pelvis is anteriorly rotated and tilted upwards as well. The dominant elbow is the one gripping the ball is in flexion. It's flexed. The shoulder girdle is upwardly rotated. The wrist is slightly elevated and rotated medially. Your non-dominant elbow is flexed. The shoulder girdle is slightly rotated upwards, but not as much as your dominant shoulder. The wrist is in a neutral position, stabilizing the ball, also acting as a guide hand.
The final phase of shooting a fallow shot is the follow-through. The legs are fully extended while the ankles are in plantar flexion. The trunk is vertical. The hip is lined up vertically with the knee and the ankle. The shoulder is in shoulder flexion. The elbow is in full extension, and the wrist of the dominant hand is flexed. The non-dominant hand should be slightly pronated.